Thank you everyone for joining us today. Southwest Youth and Family Services is delighted to welcome everyone here in our community to support and discuss this very critical matter of clean school buildings as it relates to I-2117. So I wanted to start off with some context, first introducing myself. My name is Essence Russ and I serve as the Executive Director here at Southwest Youth and Family Services. Some pretty critical information that the Office of Financial Management was able to offer to capture the CCA's purpose really well, really captured my attention. So the CCA centers environmental justice and equity, ensuring communities that bear the greatest burdens from climate change and air pollution today see cleaner and healthier air as the state cuts emissions. Specifically, the CCA requires that no less than 35% of annual investments, with a goal of 40%, must provide direct and meaningful benefits to vulnerable populations and meaningful overburdened communities. Southwest Youth and Family Services serves many immigrant and refugee families. Our staff is 55% bilingual and 82% Black and Indigenous people of color. We are made up of the overburdened communities that this initiative speaks to. So repealing this act could potentially impact the availability of clean air and safe transportation options for many of the families that we serve who may not otherwise have the means to afford a different option. Initiative 2117 aims to address these critical needs, supporting families and achieving better living conditions and opportunities for all of the families that we serve. So coming up next, I would love to introduce Andrew Eccles. Andrew is an educator and a member of the Washington Education Association. In addition to that, he is the substitute president for the Office of the Seattle Education Association. He's a paraeducator working with primarily high school students here in the city of Seattle. Andrew?
Thank you so much, Essence, for the introduction, and thank you all for being here today and everything you do. Thank you for everything you do for our students and families here in Delridge. My name is Andrew Eccles. I'm an educator in Seattle. I'm the president of the Seattle Substitutes Association. I'm a substitute educator, so I've been around the district a lot. I'm also a proud member of the Washington Education Association. We're 90,000 educators in every corner of Washington state, and as a union, our vision is really clear. We want to ensure outstanding public education for every student in Washington. And I'm here today to say that Initiative 2117 really flies in the face of what we stand for. We, as Washington Education Association, are really proud to join more than 450 organizations and tribal nations across our state who are opposing Initiative 2117. 2117 is a deceptive and dangerous initiative that would hurt students and families and educators across Washington state. And for us as educators, we're really dedicated to ensuring that students learn and grow, and what we do is absolutely foundational to families here in our state. What educators absolutely do not need is a hedge fund multimillionaire trying to gut the programs that allow students and teachers to learn in healthy, safe, and modern environments. So if it's passed, Initiative 2117 would cut over $175 million in funding to make school buildings cleaner, more modern, and safer by installing better HVAC, air filtration, and air conditioning systems. We know through our own experience it's getting hotter and hotter every summer and smokier and smokier. We're having these periods of intense smoke where we sometimes have the worst air quality in the world. Just like adults, our students always perform their best when the classroom is not too hot, too cold, or smoky. And to make sure our classrooms are the best learning environments they can be, our schools need the modern HVAC and air conditioning systems that Initiative 2117 would cut funding for. The data on this is really clear. Extreme heat and polluted air really hurts our kids' cognitive abilities, making it harder for students to learn. I've really seen this firsthand trying to teach in a classroom that is too hot or has smoke in it. It really impacts us as educators, it impacts our students. When we lack clean and cool air that the modern buildings provide, we're all impacted negatively. The other thing I've really witnessed is with the increase in our smoke seasons and extreme weather, we're seeing more often times where elementary schools have to cancel recess and bring students inside because the smoke is too dangerous. Some of our schools, many of our buildings are modern and can serve as refuge from the heat and smoke for our students and be safe places for them to be. But Initiative 2117 would gut our state's funding and program to update buildings to ensure that every child in Washington gets an education in a modernized building with cool and clean air no matter what's happening outside. We're focused on clean buildings today, but I also want to highlight that Initiative 2117 would really devastate our efforts to convert diesel polluting school buses to electric clean vehicles for our students. And it would slash hundreds of millions for pedestrian and bike safety programs that are being installed on the pathways to schools. And it would end the program that provides youth across Washington with free transit. And I'll say as an educator, it's been really beautiful to see the progress that's made here, getting to see families and students riding their bikes and walking together to school through healthy and safe streets, as well as our high school students experiencing the freedom of a free Orca pass and getting to navigate the city by transit. Initiative 2117 would eliminate the progress we are making there. Across the board, 2117 is a bad deal for students, families, and educators. So I want to thank you all again for being here today. Thank you to my fellow speakers who I know are working every day to fight this dangerous initiative. 2117 makes it harder for students to learn and for us teachers to teach. That's why the Washington Education Association is urging our members, our families, and our fellow workers across the state to vote no on Initiative 2117. With that, I'd like to hand it over to Dr. Vin Gupta.
Hi everybody, it's great to be here. So I'm Dr. Vin Gupta. I'm a pulmonologist, see patients with underlying lung disease for part of my time. I've been a pulmonologist here in Seattle off and on over the last 15 years. And have seen the growing plight of air pollution, not just here in Seattle and the Pacific Northwest, but across the country. And I think one thing has been clear in my role at the University of Washington, at the Institute for Health Metrics and Evaluation, one thing we've seen is that air pollution by itself is the 5th leading risk factor for death and disability worldwide. And Andrew said it, Essence has said it, we're seeing more of this. We're not just smelling it. We're actually seeing it. We just saw it this past weekend. Air quality is now a clear and present threat to our health, and especially for children. We're seeing now that children, if you get exposed even to a few days of wildfire smoke across the West Coast, your risk for having a long-term lung impairment is higher. Your risk of developing childhood asthma is higher. And so this is real. This is real in a way in which I think even 5 years ago, when we were talking about air pollution, we didn't have to deal with these summers the way we did 5, 6, 10 years ago. But now we're actually seeing data sets show that air pollution, again, by itself, is an independent risk factor for death and disability. So that's why, when I hear about 2117, when we think about its impacts on HVAC systems, all the amazing work that's being done here, just making sure that the air that people breathe inside these buildings, children are breathing inside these buildings, is clean. Why does that matter? Well, there's separate information research that's been produced by leading schools of public health showing that if you're breathing toxic air within the 4 walls of a school, in a hospital setting, in an office building, that actually does have cognitive impairment impacts. It's real. Andrew just mentioned it. So HVAC system repairs are critical. It's something that the Climate Commitment Act actually made sure was earmarked, that we had the ability to provide this type of funding for these types of organizations to make sure that the air that we breathe within the 4 walls of any type of organization is clean. That doesn't just impact your lung health, it impacts your brain health. It's really, really critical. And we talk about this, as a pulmonologist, I get asked all the time, well, what about bird flu? What about the next pandemic? Yes, clean air, ensuring clean air within the 4 walls of any sort of building is vital for maintaining or mitigating the risk of infectious disease. But it's also good to make sure that we're optimizing our brain health and our cognition. So that's number one. I think just to be clear here, in terms of the impacts of 2117 on on the moment that we live in. So first, it would end the requirement for the state to take immediate action on improving air quality across Washington, ending funding sources for programs to reduce toxic air pollution. Second, it would hamstring our efforts to prevent a major driver of wildfires or of air pollution, which is wildfire smoke, forest management, everything that comes with reducing the risk of wildfires anywhere in the Cascades, in the northern Cascades, things that have impacted just the last week of the air that we've been breathing. This has been highlighted by the prior speakers. It would devastate funding for the transition of our diesel school buses to electrical school buses. And why does this matter? Diesel exhaust from diesel vehicles like school buses produces the most amount of toxic air that is the leading risk factor for the development of childhood asthma. That is a serious risk. This is not just abstract. This is real here. This is why you're seeing leading healthcare organizations across the state speak up. We don't put on white coats to be overtly advocating for policy. We're trying to protect patients. But when policy can impact patients, we're going to speak up. Devastating our statewide transportation efforts to transition to a cleaner future impacts lung health. And then lastly, I'll say this, I've already said this before, improvements to HVAC systems. We are now living in a moment where infectious disease is obviously a clear and present danger. So just for that reason alone, we should be wanting to invest in HVAC system repairs for public schools across the country, for this building behind me, for our hospitals, for our office buildings. So that's reason enough. But then when you think about the fact that we live in an environment where there's toxic air potentially around us for many months, and that it can seep into these buildings, we want to make sure that our air is clean from chronic air pollution, regardless of the source. So lots of reasons here from a public health standpoint to oppose 2117, to vote no on 2117. It's a bad deal for Washingtonians, for patients across the state, and it's going to really mean a terrible thing for lung health across the state. Thank you.
Nice to meet you.
My question would just be, has the measure that this was repealed benefited the Southwest Youth and Family Services yet, or do you have anything in the pipeline? What's a concrete example of that?
Yeah, sure. Well, over $200,000 of the funds are earmarked to our organization. And so the direct impacts, I would say, as Dr. Gupta already mentioned regarding transportation, a large part of the families that we serve rely heavily on public transportation. And so this would impact creating safe walkways, creating bike lanes within 2 miles of the schools that we serve and support. It would directly impact our counseling clients that we serve and support. So the children and their families often utilize public transportation in making their way to and from our facility. I would also say we have a community resource center that supports primarily a Cambodian population of senior citizens, and so the pieces of this initiative that would support disabled and senior population specifically, we would be impacted in that way as well.